Hi, I'm Dr. Parijat Kumar, the current director of International Sports and Orthopedic Manual Therapy. I hope you enjoyed today's webinar and that was an eye-opener for you. I hope you all practice evidence-based and ethical practices and study that way. So today we are going to discuss the quiz answers in this video. The first question was that if you think you study or practice evidence-based, which of the following quality of evidence you will not be including in a highly cited research? The correct answer to is expert opinions. You will not be including expert opinions much when you are looking for highly cited. The other three options, and the number one could be the systematic reviews and the randomized controlled trials, that you will be including when you're looking for highly cited research. So the correct option or the correct answer to this is expert opinions. Next question, it is important to study and see the evidence available for the techniques in the course or the workshop before you sign up for it. Whatever workshops or courses you are signing, please watch or see the evidence for it. It's true. That's true. The correct answer is true. Which of the following technique has the lowest quality of evidence? Our next question. So you have to practice and learn those techniques which have evidence behind it. The correct answer for this question is cupping therapy. Mobilization, manipulation and muscle energy techniques, they have a lot of evidence and database. But cupping therapy till now has not been proven very much about having a high quality of evidence or not. So the correct answer is cupping therapy. Next question, that if you think that again you study or practice evidence-based, what does P stand for in clinical P rules? P stands for prediction. I have been having a lot of students and people who say that yes, they are practicing evidence-based, but when it comes to answering any of the clinical prediction rules, they don't know what I'm talking about. So guys, this is the evidence. P stands for prediction. All right. The next question was, it is important to know what to treat first rather than knowing how to treat first. It is important to know how to treat first as well. But before you know that, it is important to know what to treat first. I have repeated this question in my quiz actually a couple of times. So the correct answer is true. Before you jump onto these techniques and treating how to treat like taping, ultrasound, electrical modalities, manipulation, mobilization, please assess and see what to treat, what structure to treat. You cannot be applying all those generalized techniques, treatment techniques on the patients. So please determine the structure and the assessment first and then start treating. So the answer is true. Which of the following level of evidence should be considered first when studying or practicing evidence-based medicine? So the number one priority and the correct answer for this would be clinical practice guidelines. You need to look for them. In order to give a clinical diagnosis to the patient, a single special test can help to determine it. Not at all. You have to do a cluster of tests. You have to do a battery of tests in order to do a proper assessment and come to a probable clinical diagnosis. So the correct answer is false. Which of the following methods should be adopted to know exactly about the current trends in PT education and practices? You can't be doing electrical modalities without assessment. You can't be following these 2-day, 5-day fancy workshops and courses and write in behind your name in order to practice this evidence-based. And please also stop following much of these social media things like YouTube. You can learn stuff, but that too which is evidence-based. So the correct answer is actually the fourth option. You need to adopt a habit of learning latest evidence-based, a proper manual therapy or a manual skill program. Please study, please read the articles of what you're going to do. Next question was a quite elaborate question, is that the mainstream physiotherapy practice right now is crowded on many unproven techniques like cupping, taping and these soft tissue manipulations and all. Believe me, there aren't much evidences for that. So it is the utmost need of this hour right now that we follow those interventions which are proven of value and discard which are not proven. This is true. So you need to follow those which has been proven and which has the evidence. Please guys, follow the evidence based. I'm again and again saying the same thing. Now next question was a little kind of a funny question, that I can be a certified manual therapist or a healthcare practitioner, which I many times see in India here, by just attending a 2-day or a 5-day or a 10-day certificate or a course or a workshop like that, but no supervised hours, nothing like that. That's wrong. That's not a healthy practice. The answer is false. You cannot be a certified healthcare practitioner or a certified manipulative therapist or a manipulation or just by 1 or 2-day thing. You have to have a supervised clinical training on that as well and follow a proper evidence-based program. So guys, I hope you learned some stuff from our today's webinar. Please let us know if you want some more topics to be discussed at our iSound platform, and we would welcome your suggestions and your feedback. All right. This is Dr. Parijat Kumar, the director of iSound. Keep learning. Thank you so much.